Hello, my name is Tyler Dawson, and today we will be doing a cardiovascular and peripheral vascular exam. First thing that I would really like you to do is if you could lift your head up, we're going to take a look at your jugular veins here on both sides of your neck. If you could pull your hair back for me, please. Thank you. Okay. And if you turn your head to your right, very good. And if you could turn your head to the left there. All right, very good. Taking a look there, jugular veins are not distended. Carotid pulsations are visible bilaterally without abnormal prominence. Next, what we're going to do is we're going to take a look at the point of maximal impulse. So realistically, if we were looking at everything and you were draped, we would be looking at the PMI at the fifth intercostal space just below here at your mid-clavicular line, and kind of taking a look at it. No visible lifts, heaves, or abnormal pulsations. Next, what we're going to do is I'm going to palpate around your chest, okay? So we'll start off with feeling your carotid pulses, okay? All right, very good. Pulses are 2+ bilaterally, smooth and equal without thrills. And next thing we're going to do is we're going to palpate the angle of Luis. This is found where the manubrium connects to the body of the sternum. So we would be feeling it right here. There is no abnormal pulsations or thrills there. Next, we'll go down to your aortic area. This will be at the second intercostal sternal border. Here, no abnormal pulsations or thrill. Next, we'll move over to the pulmonic area, which is left to the second intercostal muscle at the sternal border. No abnormal pulsations or thrills here. We'll move down here to the tricuspid area. This would be at the fourth intercostal space, the fourth and fifth interspace at the level of the xiphoid. So finding here is no thrills or lifts here. And the next thing we'll do, we're going to palpate your mitral area. This is also the expected location of the PMI that we talked about earlier. So this is the fifth intercostal space to the left MCL. Findings here, again, normal findings. PMI is palpable to the fifth intercostal space, small and brisk, no displacement or enlargement. Next thing we're going to do, we're going to take a listen to your heart. I'm going to start off by using I'm going to listen with the bell of my stethoscope, even though my stethoscope doesn't have a bell. Can you hold your breath for me? Okay. No bruise detected or appreciated. Next, we're going to listen to the landmarks on the heart. So we'll start off again with the aortic area. Heart rate is 80 beats per minute. Normal rhythm, regular. Move over to pulmonic area. Moving down to the tricuspid area. down to the mitral area. Okay. S normal findings, S1 and S2 are present, regular rate and rhythm, no murmurs, rubs, clicks, no abnormal S3 or S4. So I would kind of like you to do is kind of lay back for me. We're going to listen for abnormal sounds, S3 and S4 murmurs. So what I'm going to have you do is kind of lay back. Okay. I'm going to take a listen to you, similar to what we were doing before. And then when I ask you, I'd like to kind of have you tilt to your left, okay? Okay, can you turn to your left for me? Okay, very good. No adventitious sounds, no S3, no S4 murmurs. Now we're going to I'm going to ask you to sit up right here for me again, okay? We're going to take a listen to the left sternal border and apex area for aortic murmurs. So what I'd like you to do is sit up, lean forward, and exhale for me. Okay, very good. No murmurs heard, heart sounds remain regular. Next we're going to take a look at the your peripheral vascular system. So what I'd like you to do is, if you can, just hold your arms out for me. Size, symmetry, everything are all regular. No discoloration of the nails or skin beds. Also going to take a look at your legs, so if you could lay back for me and put your legs up for me. Take a look at the symmetry of the legs, color of the skin, nice and pink, no discoloration of the toenails, normal distribution of hair on the legs, no varicosities of the veins. If you could, let's stand up and take a look at that for me real quick. Very good. I don't see any varicose veins. If you could turn around for me, please, and face. Okay, looks good. You can have a seat. So normal findings: arms are symmetrical, no edema or cyanosis. Veins are flat, non-ascending. Legs are symmetrical. Skin warm. Even hair distribution. No varicosities, rashes, or ulcers. Next, what we're going to do is kind of palpate. We're going to, I'm going to, if you could hold your arms out for me, I'm going to check your radial pulses here. And I'm going to check your brachial pulses up here. Radial and brachial pulses are 2+ bilaterally. While I'm doing this as well, I'm going to take a look at your epitrochlear lymph nodes. I do not see any lymphadenopathy noted. Cap refill, I'm going to hold out your fingers. Great. Cap refill is less than 2 seconds. Next, if you want to lay back this way for me, head here. We'll take a look at the pulses in your legs. We will start off with the dorsalis pedis, which are normal and 2+. We'll move down to your post tibs. 2 plus equally and bilaterally on both sides. We'll move up to your popliteal pulses. 2 plus and equal bilaterally. We'll move up here to your femoral. Those are 2 plus equal and bilaterally. Next, we're going to just kind of palpate for your inguinal nodes. I don't see or feel no enlargement or tenderness. We'll do the cap refill here on the toes. That's your normal findings. They are 2 plus bilaterally. Next, we're going to kind of take a look at edema. So I'm going to press with my thumbs. Shins here. Okay, no pitting edema noted. You can go ahead and sit up. We're going to kind of complete the test here, doing a few special tests. One's called the Allen test. If you could hold out your right hand for me, make a fist. All right, I'm going to compress both your ulnar and radial arteries, okay? Okay, now if you can open your hand for me, I'm going to release the radial, or excuse me, I'm going to release the ulnar artery. Very good. Palm blushes pink within 3 to 5 seconds, indicating good collateral circulations. If you could hold out your left hand, please. Make a fist. We're going to do the same thing. All right, if you can unclench your fist for me. We're going to release the radial artery. Good job. Same thing. We're going to say palm flushes pink within 3 to 5 seconds, indicating good collateral circulation. Next, what we're going to do, if you could lay your head back again, I apologize. We are going to test for arterial insufficiency of your lower extremities. So what I'm going to do is I'm going to raise both of your legs to about 60 degrees, okay, until we kind of lose color in your foot here. All right, you ready? Okay. Gotta do this for about a minute. It's gonna be like the longest minute of your life. I'm sorry. Alright. We'll put those back down. I'm gonna have you come over here and dangle for me. Okay? And dangle your feet. Very good. Finding feet return to pink, color within 10 seconds, veins fill within 15 seconds, indicating normal arterial flow. I think that completes our assessment of the cardiovascular and peripheral vascular system. Thank you so much.